How's it going, everybody? I'm Anthony Carrillo, the Father Involvement Coordinator for Ben Archer Health Center. I'm here to talk to you guys about how to support postpartum depression with father involvement. There's lots of things that happen that we don't even recognize as dads. Postpartum depression is one thing. I'm sure, the least amount we've heard is, mom having a tough time. But when do we know it's actual postpartum depression compared to, having a tough time? That's what we're going to get into right here. And, hopefully can help learn something right here and, remember something that might help you in the long run. The birth of a baby can trigger a mix of powerful emotions, from excitement and joy to fear and anxiety. But it can also result in something that you might not think or might not expect: depression. Most new moms experience postpartum baby blues after childbirth, which is commonly include mood swings, crying spells, anxiety, and difficulty sleeping. Baby blues typically begin within the first 2 weeks or 3 days after delivery. I'm sorry, the first 2 to 3 days after delivery, and may last up to 2 weeks. But some new moms experience a more severe, long-lasting form of depression known as postpartum depression. Rarely, an extreme mood disorder called postpartum psychosis can also develop after childbirth. We'll talk about that in a bit. Postpartum depression isn't a character flaw or weakness. Sometimes it's just simply a complication of giving birth. If you have postpartum depression, prompt treatment can help manage the symptoms and help, the bond with your child. The sooner you get help, the sooner it starts working and starts helping. Symptoms. Signs and symptoms of depression after childbirth vary, and they can range from mild to severe. Let's talk about the mild ones. Baby blues. Baby blues, they're signs and symptoms of baby blues which last only a few days to a week, maybe 2 weeks after your baby's born. It's not as long. You can tell the difference after 2 weeks and it's still going on. Then yeah, it's something like, all right, I recognize this is happening. Let's get some help. So the symptoms and signs include mood swings, anxiety, sadness, irritability, feeling overwhelmed, crying, reduced concentration, appetite problems, and trouble sleeping. Sounds like the typical, feeling blue type of mood versus what we're going to talk about right here as postpartum wise. And like I said, when feeling blue, it lasts, 1 to 2 weeks. Postpartum, it lasts way longer. Postpartum depression may be mistaken for baby blues at first, but the signs and symptoms are more intense and last longer, and may eventually interfere with your ability to care for your baby and handle other daily tasks. Symptoms usually develop within the first weeks after giving birth, but may begin earlier, during pregnancy, or even later. Up to a year after birth is the latest it can, take to kick in. Postpartum depression signs and symptoms can include depressed mood or severe mood swings, excessive crying, difficulty bonding with your baby, withdrawing from family and friends, loss of appetite or eating much more than usual, inability to sleep, insomnia or sleeping too much, overwhelming fatigue or loss of energy, reduced interest and pleasure in activities you used to enjoy, intense irritability and anger, fear that you're not a good mother or father, hopelessness, feeling of worthlessness, shame, guilt, or inadequacy, diminished ability to think clearly, concentrate, or make decisions, restlessness, severe anxiety and panic attacks, thoughts of harming yourself or your baby, reoccurrent thoughts of death or suicide. Untreated postpartum depression may last for months or longer. And just like I said, the sooner you start to seek treatment, the sooner it can start to help and start taking effect. Let's talk about the causes. There's no single cause for postpartum depression, but physical and emotional issues do play a role. Physical changes. After childbirth, a dramatic drop in hormones, estrogen, and progesterone in your partner's body may contribute to postpartum depression. Other hormones produced by your thyroid gland also drop sharply, which can leave you feeling tired, sluggish, and depressed. Emotional issues. When you're sleep deprived and overwhelmed, you may have trouble handling even minor problems. You may be anxious about the ability to care for a newborn. You may feel less attractive, struggle with your sense of identity, or feel you've lost control over your life. All these issues can contribute to postpartum depression. It's kind of, with all emotions, some stack up, and once a certain amount stack up, you can only handle so much. So it sounds like to me, if you have a lot of extra stuff, extra stressors stacked up and everything, it can help trigger or help, what's the word, create postpartum depression. Let's talk about the risk factors. Any new mom can experience postpartum depression, and it can develop after the birth of any child, not just the first. However, your risks increase if you have a history of depression, either during pregnancy or at other times. You have bipolar disorder. You had postpartum depression after a previous pregnancy. You have had family members who have had depression or other mood disorders. You've experienced stressful events during the past year, such as pregnancy complications, illnesses, or a job loss. Your baby has health problems or other special needs. You have twins, triplets, or multiple births. You have difficulty breastfeeding. You're having problems in your relationship with your spouse or your significant other. You have a weak support system. You have financial problems, and the pregnancy was unplanned or unwanted. All those risk factors are stressors, just life's problems, getting at you and stacking up. So yeah, definitely, all those can stack up and be a risk to postpartum depression, to lead to postpartum depression. Let's talk about complications. Left untreated, postpartum depression can interfere with mother-child bonding and cause family problems. Now, a while ago, I mentioned dads can get postpartum depression too. So, if dad's feeling the same way, that's something to try to recognize. And we'll be talking about that here in a bit. For moms, untreated postpartum depression can last for months or even longer, sometimes becoming a chronic depressive disorder. Even when treated, postpartum depression increases a woman's risk of future episodes of major depression. For fathers, postpartum depression can have a ripple effect, causing emotional strain for everyone close to a new baby. When a new mother is depressed, the risk of depression in the baby's father may also increase. And the new dads are already increased risk of depression, whether or not their partner is affected. For children of mothers who have untreated postpartum depression are more likely to have emotional and behavioral problems, such as sleeping and eating difficulties, excessive crying, and delays in language development. It seems like postpartum depression affects everybody, whether you have postpartum depression or not. And that's a good reason to recognize it and try to help alleviate the stress that comes with it. Let's talk about postpartum psychosis. With postpartum psychosis, a rare condition that typically develops within the first week after delivery. The signs and symptoms are severe. Signs and symptoms may include confusion or disorientation, obsessive thoughts about your baby, hallucinations and delusions, sleep disturbances, excessive energy and agitation, paranoia, and attempts to harm yourself or your baby. Postpartum psychosis may lead to life-threatening thoughts or behaviors and requires immediate treatment. Just that's one thing that I keep on stressing, immediate treatment. The sooner you get it checked out, the sooner you can start helping it out. Try to alleviate the stress within the whole family. Let's talk about postpartum depression in fathers. It's also called paternal postnatal depression. It's a common condition amongst men after the birth of a child. Up to 1 in 4 new dads have paternal postnatal depression. It's an anxiety disorder or other problems with mood can occur anytime during the first year of your child's life. Paternal postnatal depression is a very serious condition, but it is also a very treatable condition. If left untreated, however, paternal postnatal depression can result in damaging long-term consequences for yourself, your child, and your family as a whole. Unfortunately, we are really only beginning to understand postnatal depression, paternal postnatal depression. One of the things we know the least about is that it puts men at risk, for it. Here are some things that research suggests may increase chances of experiencing paternal postnatal depression. A lack of good sleep, changes in hormones, personal history of depression, poor relationship with spouse, poor relationship with one or both parents, relationship stress with a partner or in-laws, excessive stress about becoming a parent or a father, non-standard family, such as being unmarried or a stepfather, poor social functioning, a lack of support from others, economic problems or limited resources, a sense of being excluded from the connection between mother and baby. Let's go back real quick. As we list all the complications, there's complications for mom, there's complications for dad. Dad can even get, both mom and dad can get postpartum depression. But the main thing to remember is if one parent has it, more than likely the other can have it. And it's not, oh, because this person is dragging me down, they're making me have it. No, it's part of a stressful situation, and that's how we react. And that's what ends up happening. You know, mom has postpartum depression. Maybe dad can get it. Maybe he doesn't get it. But either way, we dads need to recognize it, because we don't want our partners feeling that way for so long. And we don't want our families to be, we don't want it taken out on our families, or, we don't want our babies stressing. We don't want our kids, to see mom stressing like that. It takes a toll on everybody. So yeah, when it comes to complications, it affects everybody from the baby, from mom to even the grandparents. It's just something that we need to recognize. And here in a little bit, we're going to talk about, helping it out. One thing we do know is that if your partner is depressed, there's a good chance you are too. Up to half of the men whose partners who have postpartum depression are depressed themselves. If you're a new father and experiencing symptoms of depression or anxiety during your partner's pregnancy or in the first year after your child's birth, talk to a healthcare professional. Similar treatments and supports provided to mothers with postpartum depression can be beneficial in treating postpartum depression in fathers. When to see a doctor. Let's talk about when to seek help. If you're feeling depressed after your baby's birth, you may be reluctant or embarrassed to admit it. But if you experience any symptoms of postpartum, baby blues, or postpartum depression, call your doctor and schedule an appointment. If you have the symptoms that suggest you may have postpartum psychosis, get help immediately. It's important to call your doctor as soon as possible if the signs and symptoms of depressions have any of these features. They don't fade away after 2 weeks, they're getting worse, make it hard for you to care for your baby, make it hard to complete everyday tasks, include thoughts of harming yourself or your baby, and if you have suicidal thoughts. If at any point you have thoughts of harming yourself or your baby, seek immediate help from your partner or loved one in taking care of your baby and call 911 or your local emergency assistance number to get help. Also consider these options if you're having suicidal thoughts. You can seek help from your primary care provider or other healthcare professional. If you don't have one, give me a call and I can set you up with one at Ben Archer Health Center. We have therapists, doctors, nurses, we have everything. Dentists, just let me know and I'll help you out. You can call a suicide hotline, call a mental health professional. We have therapists and psychiatrists in the US. You can call the National Suicide Prevention Hotline. You can reach out to a close friend or a loved one. You can contact a minister, spiritual leader, or someone else in your faith community. Well, there's help out there, and that's the main thing I wanted to point out in this presentation is Ben Archer Health Center has everything. So if you are worried that you don't have insurance, well, we also have a sliding scale. So if you do need the help and you notice these signs happening, give Ben Archer a call, and that'd be a good step to get you started, and we'll take care of you. So let's talk about prevention. If you have a history of depression, especially postpartum depression, tell your doctor if you're planning on becoming pregnant or as soon as you find out you're pregnant. During pregnancy, your doctor can monitor you closely for signs and symptoms of depression. He or she may have you complete a depression screening questionnaire during your pregnancy and after delivery. Sometimes mild depression can be managed with some support groups, counseling, or other therapies. In other cases, antidepressants may be recommended, even during pregnancy. After your baby is born, your doctor may recommend an early postpartum checkup to screen for signs and symptoms of postpartum depression. The earlier it's detected, the earlier treatment can begin. If you have a history of postpartum depression, your doctor may recommend an antidepressant treatment or psychotherapy immediately after delivery. So let's talk about how we can help. People with depression may not recognize or acknowledge that they're depressed. They may not be aware of the signs, the symptoms of depression. If you suspect that a friend or a loved one has postpartum depression or is developing postpartum psychosis, help them seek medical attention immediately. Don't wait and hope for improvement. Do something about it. Like I said, I've mentioned earlier, if it's an emergency, just call 911. Get it checked out. One thing to look out for would be crying. Okay, it's okay. Yeah, crying is a symptom of baby blues. But if and that'd be a reason to schedule an appointment with your doctor. primary care provider, and we'll just keep in contact with them. Um, and if the crying keeps going for like more than a week, then yeah, that's another sign right there. It's not baby blues anymore. I think this is postpartum depression, and let's see how we can get this taken care of. Let's call our PCP. Or if it's very severe and there's other thoughts and other stuff that you recognize, like, oh, I'm not too comfortable waiting on my PCP, then call 911. It's better to be safe than sorry. And just like it says right here, the sooner you seek treatment, the sooner you can get help. The sooner it starts helping, the sooner you can move on and enjoy your little bundle of joy. So when it comes down to it, we partners in a relationship need each other's support. The way I supported my wife is by completing some of her daily tasks for her, so she could have some time to rest or even be alone. There were many times when I felt she was overreacting, and I had to stop and think, like, oh, yeah, no, she's not mad at me. She's not, it's not her. It's all the shift of hormones. It's the changing in her body, all going on at once. Yeah, she might just be there, but there's a lot going on in her body, and we got to consider that and not take stuff personal. Yeah, so we gotta remember the process. Her body's going through these changes. There are going to be some mood changes, and it comes along with it. It's all part of the process. Be patient. Don't take anything personal, and think, how can I help make a more comfortable environment for my child during this time? That's like a number one thing to be thinking about. How is this affecting my child? And we dads are going to have to deal with a little bit of hurt and trouble and stuff, but in the end, it's not going to last forever. And we're doing it for the benefit of our family. And that's what we dads got to do. We got to take that role and support, just like mom has to support us too. It works both ways. But that's it. That's my presentation. Thank you for watching, and thank you for viewing. We have some more coming up in the future. If you have any questions, please post them in the comments. I'll get to you as soon as I can. But like I said, for all of New Mexico, Ben Archer Health Center, we have primary care providers, therapists, psychiatrists, dentists. We have everything. So if you have problems with postpartum depression, anybody who has problems with postpartum depression, anybody who needs a dentist or PCP, we have everything. We're here to help. And I think Ben Archer Health Center would be a good stop if you do ever run into these issues. But yeah, like I said, thank you once again. I'll be seeing you guys another time. You take it easy. I'll see you later. Bye.